What is the follow-up after partial nephrectomy for kidney cancer? After a partial nephrectomy for kidney cancer, follow-up care is crucial. This care helps monitor recovery, detect any recurrence of cancer, and manage kidney health effectively. The follow-up plan usually includes clinical assessments, laboratory tests, and imaging studies. These are tailored to the individual's risk of recurrence based on tumor characteristics. The first follow-up appointment typically happens around 6 weeks after surgery. During this visit, the surgeon evaluates how well you are recovering. They will discuss pathology results, including the type and grade of cancer, and address any immediate concerns or side effects. If necessary, a referral to an oncologist may be made for additional treatment to reduce the risk of recurrence, known as adjuvant therapy. Imaging plays a vital role in follow-up care. It helps detect local recurrence near the surgical site or distant metastases. Contrast-enhanced abdominal computed tomography scans are commonly used because they provide detailed images of the kidney and surrounding tissues. For low-risk tumors, such as completely resected T1 tumors, imaging may be scheduled at 3 to 12 months after surgery, and then annually for up to 3 to 5 years. For higher-risk tumors, imaging may occur more frequently, such as at 1, 3, 6, and 12 months in the first year, then continued regularly for several years. Chest imaging, like X-rays or computed tomography scans, is also performed periodically to check for lung metastases. Follow-up visits will also include a thorough medical history and physical examination. This helps identify any symptoms or signs of recurrence. Laboratory tests may be done to assess kidney function and overall health. These visits are often scheduled every 3 to 6 months during the first few years after surgery and then annually thereafter. Most guidelines recommend follow-up for at least 5 years after surgery since the risk of recurrence is highest during this time. However, late recurrences can occur beyond 5 years, so ongoing surveillance may be considered based on individual risk factors, tumor grade, and patient health. It is important to note that, after a partial nephrectomy, the surgical site may show some enhancement on imaging due to healing or treatment effects. This can persist for up to a year. Expert radiological evaluation is needed to distinguish these changes from tumor recurrence. If there are positive surgical margins, meaning cancer cells were found at the edge of the removed tissue, the risk of local recurrence increases, and closer monitoring may be necessary. Maintaining regular communication with your healthcare team is essential. Patients should promptly report any new symptoms. Coordination among urologists, oncologists, radiologists, and primary care providers ensures comprehensive care. If patients move or change providers, transferring medical records and follow-up plans is important for continuity. In summary, follow-up after partial nephrectomy for kidney cancer involves scheduled clinical visits with physical exams and laboratory tests, combined with periodic imaging of the abdomen and chest. The frequency and duration of follow-up depend on the tumor's initial stage and grade. Most patients are monitored closely for at least 5 years to detect any recurrence early and preserve kidney health. This approach aligns with established medical guidelines and supports optimal long-term outcomes for kidney cancer patients. Always consult your healthcare professional for personalized advice and care.